is the Duchenne muscular dystrophy, which is more common in boys. The typical age of onset of symptoms is about 3 to 5 years of age, and then on the symptoms progress. So the most common symptoms are related to weakness of the hip muscles. So these children have trouble running and jumping, and they even have trouble walking. They have a typical waddling gait, and if you notice, they walk on their tiptoes. This is because of weakness of hip muscles. So they often have falls because their gait is not normal. The calf muscles are hypertrophied to compensate for the hip weakness. They also tend to have spine defects such as lordosis, and you can also see that their abdominal muscles are weak and therefore they have a protruded belly. As they grow older, there could also be involvement of respiratory muscles leading to respiratory failure, and also cardiac muscles leading to cardiomyopathy and heart failure. Now, these children often have difficulty getting up from the sitting position or from a supine position. So in them, Gowers' sign is positive. Now, what is Gowers' sign? A positive Gowers' sign is suggestive of hip weakness. These children find it difficult to stand up from a sitting or supine position because their hip muscles are weak. So they literally climb up their thighs with the aid of their hands in order to stand up. And this is called a positive Gowers' sign. Now, many also develop frequent life-threatening infections. So Duchenne muscular dystrophy is much more common in boys, though girls could be carriers. We already looked at the signs and symptoms, most of which are due to weakness of the hip muscles. Now, the weakness related to Duchenne muscular dystrophy typically affects the pelvic girdle muscles, and legs are affected before the arms. The growth velocity is also much slower in these children, leading to a short stature. And boys with this disease are often late walkers. A preschooler who has this disease may seem very clumsy and fall often. Parents may also note that these children have trouble climbing stairs, getting up from the floor, or running. And when they try to rise from the floor, they may use the hand to push themselves to an upright position. They tend to walk on their toes or the balls of their feet with a slightly waddling gait and fall frequently. Now, many children with this condition begin using a wheelchair sometime by the age of 12. They also often have learning disabilities. Unfortunately, Duchenne muscular dystrophy is progressive. So children with this condition inevitably run into different complications. So though initially there may only be a difficulty in walking, most children eventually become dependent on a wheelchair. By 12 years of age, most of these children need to use a wheelchair. Likewise, though initially the disease affects the pelvic girdle muscles, eventually the shoulder girdle also becomes affected. And once there is difficulty using arms, the activities of daily living become difficult for these children. They become dependent on caregivers. Also, contractures are very common because there is a structural defect in the muscle. So contractures can further limit mobility. With time, there may be involvement of respiratory muscles leading to respiratory failure. Spine defects such as lordosis or scoliosis are very common, and they may even develop cardiomyopathy. Swallowing problems are also common. Now, currently, there is no treatment available for muscular dystrophy. Trials of new therapies, including gene therapy, are ongoing. So people with muscular dystrophy should be monitored throughout their lives. And treatment can only help extend the time a person with this disease can remain mobile and also help with heart and lung muscle strength. So therapies can only slow down disease progression, but they cannot cure the disease. With that, we come to the end of this session. Thank you.